thinking about pairing Original Medicare with the Supplemental or Medigap plan? Well, in 2026, a couple tweaks might change how these policies perform. So we're going to talk about in this video what's going to change, what's going to stay the same, and how to make sure you still have the best coverage for you. Hi, I'm Erika Smiley with Medicare School, and in this video we're going to do a refresher of how supplemental plans work. We'll look at what's going to change for 2026, what's going to stay the same, and how to evaluate that you're on the best plan that's a fit for you. So let's do a quick review of how Medigap or supplemental plans work. Well, first of all, we have these plans because they're going to fill the gaps of Medicare. There's 6 different financial gaps of Medicare, and these different supplemental plans fill those gaps, okay? So they don't replace Original Medicare, but they work with it. So if you have a supplemental plan, when you go to the doctor, you take 2 cards with you. You take your Medicare card and you take your supplemental card, because whatever Medicare doesn't pay, the supplemental plan is going to pay, as long as you see a doctor that accepts Medicare. Now, a lot of people love these plans because you can go to any doctor in the United States that takes Medicare. So there's no in-network or out-of-network with these plans. There's also a lot of freedom because they're portable. You can take them with you if you move from state to state, and they're lifetime policies. They're not going to change every year. The coverage isn't going to change. There's no networks to worry about changing. It's pretty much a set it and forget it plan. So again, they work with Original Medicare. Any doctor that takes Medicare and any procedure that's covered by Medicare, whatever Medicare doesn't pay, your supplemental plan will pay. Now, of course, there's different levels of supplemental plans. So first we have the F plan, and the F plan for these were for people who were eligible for Medicare before January 1st of 2020. So if you weren't eligible for Medicare before then, you no longer can get an F plan, okay? And then after the F plans kind of went away, people couldn't get those anymore, the G plan kind of became the most popular. And the G plan is going to cover 5 out of the 6 gaps of Medicare. So if you have a G plan, other than paying your monthly premium to have the plan, the only other thing you're going to pay is the Part B deductible. And this year in 2025, the Part B deductible is $257. Now with the N plan, which is the next most popular plan, it's just a step down from the G plan. It's going to cover 4 out of the 6 gaps of Medicare. So the thing that's a little bit different with the N plan, you're still going to pay that $257 Part B deductible, but you also have to pay a small copay when you go to the doctor. So it could be anywhere up to $20 copay for the doctor and a $50 copay if you go to the ER. And then the third thing that's different about an N plan is something called excess charges. So there's a 15% excess charge that could be possibly charged to you if you see a doctor that does not accept Medicare assignment. So this is very rare. Very few doctors in the country charge these excess charges. There's actually 8 states where it's illegal. So if you live in Connecticut, Minnesota, Massachusetts, New York, Ohio, Pennsylvania, Rhode Island, or Vermont, they can't even charge the excess charges. And moreover, you can always call ahead of time before you use a doctor or see a doctor and say, do you accept Medicare assignment, or do you charge excess charges? So it's very rare, so we don't worry about it too much. If you did have an excess charge of 15%, you would be responsible for that with an N plan, but again, it's not a huge concern. So they're gaining popularity. A lot of people are liking them because usually you can save maybe $40 to $50 a month on the premium compared to the more comprehensive G plan, okay? Now, what is the best time to get one of these supplemental plans? So remember, if you don't get a supplemental plan when you first sign up for Medicare Part B, you could have to undergo medical underwriting. So when you first enroll in Medicare Part B, this is going to line up with your Part B start date. You've got 6-month window called your Medigap OEP, and that stands for Open Enrollment Period, okay? Open Enrollment Period. And this is the 6 months from your Part B start date when you're able to get a supplemental plan without any questions asked. You could literally currently have cancer, and that's okay. If you're in your Medigap OEP, they cannot ask you any medical questions. You are guaranteed to get one of the comprehensive supplemental plans. So let's say that you enroll in Medicare in February. Your Part B start date would be February. You'd have February, March, April, May, June, July. That would be your last month to get one of these plans without medical underwriting. After that, down the road, let's say you start your Medicare journey with an Advantage plan and you want to come back to a supplemental plan. If it's been longer than a year, you're probably going to have to go through medical underwriting unless you live in a special state that has a birthday rule, or one of the 3 states, which I believe is New York, Connecticut, and Massachusetts, where you can change plans at any time throughout the year. Okay, so you can see the reason why a lot of people love supplemental plans. If they are in your budget, they give you a lot of flexibility and freedom to go see any doctor in any state. If you can afford them and you're in your budget, it's very comprehensive coverage. So let's look for 2026, some things that are staying the same about these supplemental plans. Well, first of all, we know they have that guaranteed renewability. And like I said, they're lifetime policies. So as you get older, they cannot take the policy away from you. They can't change your coverage or take it away because you're getting older or sicker. It's yours for a lifetime, as long as you pay your monthly premium. The only way they could take your policy away is if you don't pay your monthly premium. Now in 2026, these plans will continue to have standardized benefit structure. So what this means is a G is a G is a G is a G, right? An N plan's an N plan. It doesn't matter what state you live in. It doesn't matter what carrier you choose. A G plan is going to cover like a G. An N plan will cover like an N. So that's going to continue, and that won't change in 2026. Also, there'll be no networks. So again, you don't have to worry about if a doctor's in network or out of network. You can see any doctor. So that's a lot of freedom and flexibility right there. Another thing that goes with this, with these supplemental plans, you don't have to get referrals. So if you want to see a specialist, you can go book the appointment straight with the specialist. A lot of Advantage plans, you have to get a referral from a primary care physician. You don't have to work through the primary care physician with these supplemental plans. That's going to continue to be the same in 2026. Also, there's really no prior authorizations. Now, some people will say, well, hey, original Medicare is going to have prior authorizations on like 17 different things. But these are very specific, unique items. For the most part, with a supplemental plan, you don't have to worry about prior authorizations. That's going to continue. If you need a knee surgery and your doctor says it, you're just going to schedule the knee surgery. You don't have to get approval from the insurance company to approve that procedure, okay? And obviously, premiums are going to apply. You still have to pay every month for a supplemental plan. And it is interesting, we have seen the rates going up the last couple of years in these supplemental plans a little bit more than in the past. So obviously, inflation's been a little bit more overall, and especially medical inflation. We kind of talk about COVID, the COVID years, like 2020, 2021, 2022. These are years where people were not going and getting elective surgeries and things done if they didn't have to, because they kind of didn't want to take the risk of going to the hospital or going to the doctor. So people put things off, and now we're kind of playing COVID catch up. These carriers, people started going back and having all those surgeries and procedures, and they had a lot of claims come in. So that might see why we've seen an increase in these premiums. Or, I'm sorry, not the premium, the premiums and what you're getting charged every month, right? If the insurance companies have to pay more money out, they're going to raise your premiums because they're in the business of making money, not losing money, okay? So that might be some of the reason why we've seen some increases. The other reason is more and more people are working, but they may not have the best employer plans. So they might say, hey, I'm going to wait. I know how good those supplemental plans are. I'm going to wait till I'm on Medicare to get that hip replacement, right? Or to do that rotator cuff surgery I need, because I don't want to pay all the copays and the max out of pocket that my employer plan would charge me. I'm going to wait and do it when I hit Medicare. So that might be why we see some of these increased premiums. Hoping over the next couple of years, don't know for sure, but hopefully those premiums will level out some. But they will always go up. That's just a fact. Inflation, things are getting more and more expensive, and the medical industry, that's no different, okay? Now, the other thing that's going to stay the same for 2026 with these plans is that you have to have a standalone Part D prescription drug plan. So the supplemental plans do not come with drug coverage included. Now, original Medicare is going to cover any medications that would be administered to you in the hospital under Part A. If you go to like a clinic or somewhere to get a medication like an IV or an infusion, and that's administered to you, Part B would cover that. But as far as self-administered medications that you get at a pharmacy, you're going to have a Part D plan, and that's not going to change. And those Part D plans do cost money, right, depending on what medications you're on. There are some Part D drug plans that are $0. Maybe if you're in an area you're not on any medications at all, or you're on generic medications, you may have some $0 drug plans. But for 2026, we're seeing the prices go up on those where they're having more and more premiums. Some people's drug plans could be $70, $90, $120 a month, depending on what medications they're on, okay? So just keep in mind, if you do get a supplemental plan and you're gonna be enrolling in Medicare and starting one in 2026, you're also gonna have to pay for a standalone Part D drug plan as well, so you have that drug coverage and you don't get any late penalties. The other thing that will continue to stay the same in 2026 is those 8 states that we talked about that will not allow excess charges. So again, those are going to be Connecticut, Minnesota, Massachusetts, New York, Ohio, Pennsylvania, Rhode Island, and Vermont. So if you live in one of those states and you have an N plan, they are not allowed to charge excess charges in those states. That will stay the same also for 2026. Hey, if you found this video helpful, do us a favor. Go give us a like. We always appreciate it. And subscribe so you don't miss out on any of those future videos. And leave us a comment. We'd love to hear what you have to say. We love to answer any questions you have. That's what it's here for. So drop us a comment below. Okay, so what are some changes that may be coming to supplemental plans or people who have supplemental plans in 2026? Well, first of all, we just talked about those premium increases, okay? So you could continue to see hikes or increases. Those usually happen around the anniversary of when you signed up for your plan. So you may see some more aggressive premium hikes in 2026. We had some people today who asked on some live questions on one of our YouTube lives we were doing, and they said that their supplemental plans, they were like around $144. They were going up like $50 a month for the wife, like $60 a month for the husband. So it was like a 40% increase. That's not normal in the past. So we might see some heftier premium increases for these supplemental plans. Now, what can you do about that? So here's the thing. If you're outside of the, that Medigap OEP, let's say you've had your F plan or a G plan for a long time, for 4 or 5 years, you should really reevaluate and shop every 3 to 5 years. Reach out to a broker. That's what we do at Medicare School. You can always call us, and we can look at the other companies and see what the premiums are for other plans. Now, you'd have to go through medical underwriting. So there's different carriers care about different things, right? So it doesn't hurt to try and go through medical underwriting. If you can save $50 to $100 a month in premium, it might be worth it. Now, obviously, you have some major things going on, like spinal stenosis is one. If you are diabetic and you have to use more than 50 units of insulin a day, things like that. If you have cancer, major heart problems, they're not going to approve you, right? They don't want to take that risk on. But if you just have like a little bit of high blood pressure or a couple of normal things and you're fairly healthy, you probably could be able to pass medical underwriting. And again, it doesn't hurt to try. So you can always reach out to us, especially those people, if they've had an F plan, those have gotten pretty pricey. They might look at a G plan. If you're on a G plan, you can shop and go to another G plan, or maybe you want to consider an N plan. So we can always shop those rates for you and see if we can get you through medical underwriting. Now, there are some states that are birthday rule states where within about 60 days of your birthday, you have a window where you're allowed to go get another supplemental plan. It's usually like to less, so you could go from like an F to a G to an N, or like to like, maybe a G to a G or an N to an N. And those birthday states, you can just Google what the birthday states are. You have that window where you could get one of those and make that change without medical underwriting, okay? Now, another thing that is going to go up is the Part B premium. So this year, we said the Part B base premium is $185. Today's October 14th, and we don't yet know that Part B premium for 2026. We know it's probably going to go up. I've heard tossed around $206.50. That's just a number a lot of people have put out there, but we don't know the exact number yet. We'll probably know late October, early November. But expect that Part B premium that you get charged every month to have Medicare to go up a little bit in 2026. Now, the Part B deductible, same thing. This year, it's $257 for that Part B deductible. You have to pay that if you have a G plan or an N plan. That's also probably going to go up. I've seen things like 287, 288 thrown out there, but again, we don't know the exact number. But expect both of those things to go up for 2026. Now, some other changes that could happen might be benefit modifications, okay? So some of the supplemental plans may take away some added benefits, like a lot of them have a travel foreign policy where they'll pay up to $50,000 or a certain amount of care if you're in another country. We might see some of those benefits go away. Some of them might be trying to make richer benefits. So there are a couple companies that are supplemental companies that might start offering a wellness benefit. So like a gym membership. If they're in an area where there's a lot of Advantage plans, that's a perk a lot of people like. So a lot of those, I know United Healthcare is one company that offers, it's through Renew Active. You can get a gym membership. Humana has a few, I think, that offer gym memberships. So we may see more of that come in the next year with supplemental plans as they continue to compete with Advantage plans. All right, so another changes that are going to happen in 2026. This is actually changes in the Part D drug plan, but this is going to impact you if you have a supplemental plan, because you also have to have a Part D drug plan to go with that supplemental plan. So one of the main changes we're seeing in the Part D plans is the premiums. The monthly premiums are going up. So they're allowed to increase up to $50 per month, and a lot of companies are maxing out and taking that. So other people who are on $0 plans, we're seeing their plans are like going to $9 now, right? So there's still going to be some good plans in your area that should be under $15 or $20 a month, but we are seeing the premiums rise some on these Part D plans. And that's something to take into account, right? If you have a supplemental plan, you're paying your Part B premium, you've got to pay for that supplemental plan, and your drug plan might cost $70, $80, $90 a month, depending on the medications you take. So just something to factor in when looking at your overall budget on what you're going to pay in 2026 each month. Now, a couple other things that are changing. One is the Part B deductible, okay? So for 2025, the max deductible on a drug plan is $590. That's going up by $25 in 2026. Next year, that deductible on Part D drug plans could be as high as $615. Now, that doesn't mean that your drug plan necessarily will have that high of a deductible, but it could be as high as $615 next year compared to $590, which it was this year in 2025. And now, really with this deductible, keep in mind, Tier 1 and Tier 2 medications, which are those preferred generics and the generics, are usually exempt from this, okay? So if you're on generic medications, you may never even hit that deductible because you're paying $0 to $10 probably for those generic medications. You're not having to pay that deductible. This comes into play with more Tier 3, Tier 4, Tier 5, which are the brand names, preferred brand names, specialty medications. And if you do have a medication that's $500 a month, you may have to pay that first, $5,000 a month. You'd have to pay that first $615 before the plan would start to pay. After that, you go into the second coverage phase, which is called the initial coverage phase, and you only pay 25%. After that, you hit your cap for the year, which is called the catastrophic cap, and that's going to change as well. So for 2025, the catastrophic cap was $2,000. So in a calendar year for 2025, you won't pay more than $2,000 out of pocket for your medications, as long as your medications are on formulary with the plan you have, okay? So when you hit $2,000, you can put your pocketbook, your wallet away, and Medicare is going to pay for the rest of it. That is going up by $100 for 2026. Next year, the catastrophic cap will be $2,100. Now, this is still really great because there are people who have very, very, very expensive medications that are thousands and thousands of dollars a month. So if you're on a medication that's $8,000 a month, I mean, this is huge that you have a cap with these Medicare drug plans where you're not going to have to pay that much for your medications, okay? So that is going to be a factor for people with supplemental plans. There's changes to the Part D plans that you need to be aware of, okay? And then also the transparency and changes in these plans. So all of the carriers, a lot of them, this is going for Advantage and supplemental plans, they're just having more rules about transparency with their companies, changes they're making to their plans. But again, with a supplemental plan, your coverage, you don't have to worry about networks. You really don't have to worry about a lot of changes with these supplemental plans. plans. So what does this mean to you if you have a supplemental plan or if you're thinking about getting a supplemental plan? Really, there's not going to be huge changes. Really, you just want to keep an eye on your premiums and see how much they're going up in 2026. Again, if you ever want to shop and look at other carriers, give us a call. We can always compare and see what's in your area. Now, not only is it a benefit that you could save money each month if you go with a new plan, also it's going to put you in a fresh group, like a new group and pool of people. So let's say you've been on a G plan for 5 years. That group of people is shrinking, right? If new people aren't coming into the plan, people are getting sick, people are dying, it's getting smaller, and there's less people to spread that risk out, so your rates continue to get higher. You get in a fresh new group, not only might you save some money on your premium every month, but it's just going to kind of reset the clock for you. So really just keep an eye on your premiums. Know that what you're going to pay for that Part B deductible, if you have a G or an N plan, that's probably going to change in 2026. And what you're going to pay for Medicare Part B is also probably going to go up as well. Also, if you have an IRMA and you're a high income earner, that's an income-related monthly adjusted amount. That means if you make more than a certain amount, they're going to look 2 years back at your tax returns, you're going to have an IRMA. So we expect in 2026 those IRMA prices to go up some, what the IRMAs are and how high the brackets are as well. But for the most part, if you have a supplemental plan or you want to go the supplemental route, all of those plans are still going to offer the freedom, the flexibility, and the comprehensive coverage that people love. Yes, they have a price tag to them every month, but it's the freedom of being able to go to any doctor you choose, not having to worry about referrals and prior authorizations, being able to have that flexibility if you're a snowbird or you travel or if you move. It's just great because you have that comprehensive coverage. You don't have to think about it. So if you still are thinking about supplemental plans, price tag might go up a little bit more in 2026, but they're still going to be a very fantastic option. And remember, it's important that you can afford your health care, right? Supplemental plans aren't for everybody. If the price tag's too high for you, Advantage plans are definitely going to be a much better route to go than just having original Medicare only. But as always, give us a call. Our guides are happy to talk with you, kind of assess your current situation, talk about what medications you're on, and show you all of your options so you can make an informed decision and choose the plan that's going to work best for you in 2026 and beyond.